So should a physician use a different approach with their patients when it comes to telehealth versus in-person visits?
Um, I think one of the challenges that I don't think there's any data on this per se yet is I do think patients, particularly for those maybe have a different patient demographic, patients are home right now. We're all kind of locked in. I think the patient visits sometimes when the patient's in the clinic, maybe the surgical specialties or other kind of procedural type specialties, a lot of the workup is happening before the physician's actually in front of the patient in the room. And so that visit in person may be able to be more efficient actually than being on video. And so I think it will be interesting to see how, if it starts to take the physicians longer for the video visits versus doing the things in, some of the care in person, and how patients really respond to that, because patients are going to want to connect with their provider. But I do think, looking at patient satisfaction surveys over the last 20 years that I've been in healthcare, the key component from a patient perspective is they want to feel connected to the physician. And so I think making sure that if you are doing video visits, you're really, connecting with the patient, you're not multitasking, all of those same things that would be pertinent in an exam room are even probably more important when you just have a video camera and they can't physically connect with you in some way. So I think those are things to really think about. I also think you need to, you can use staffing to help facilitate some of the telehealth visits. I've heard a lot of different stories of patients trying to use technology that they may not be used to. And so having a staff member who can help get the patient comfortable with the technology kind of before the physician comes in the room, or the staff member may be doing some of the medication reconciliation, the patient history, some of that intake process could still occur via video before the patient kind of joins the meeting or the visit, if you will. And so I think there are some opportunities to continue processes that you already had in place with having the staff members help you with part of that care. But the technology definitely has been a challenge. I know I've heard of patients trying to do the video visits from their phone or from the car driving. Was one. But so there might be opportunity to start putting in place perhaps a technology check-in where the patient would connect with some member of the staff from the practice to make sure the technology is working and those kinds of things. So starting to think about that in advance so the visit can go as smoothly as possible. I also think that one of the things to be cautious about is that there are things when you're sitting in front of a patient, you can see the entire person versus just the top half. There might be conditions that the physician might notice that might be harder to see behind a video camera. And so I think as we go forward, it will be interesting to figure out, how are we having patients really connect and engage, and what information are they providing and responsible for providing to the provider via questionnaires or some of that kind of pre-work, so that the provider doesn't miss anything because they're doing it via video that could put them in a situation where they make the wrong diagnosis, or they have a poor outcome because they didn't have all the information that they might have in an in-person visit. So I think that most providers, I think, are conscious of that and trying to, which has probably been one of the hesitancies, I think, to getting telehealth off the ground prior to all the changes we've had and being forced into it with COVID. But I think as we move forward, some of the regulations will probably get a little more, stricter again. How can we have the patients really both better understand kind of their role and their responsibility in these visits? So